Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Ross Thompson from the University of California, Davis. Thank you for joining us.
My pleasure.
Today's session was about addressing childhood disparities. We had a lot of good content. One of the things that is well known is that pre-K is helpful. We're asking people to invest in pre-K. And when people invest in things, they want to know that it's going to last. There's been some recent controversy about the lasting effects of pre-K through the research in Tennessee and some other programs. What can you tell me about what we can do to make the effects of pre-K last?
Well, it's important to recognize that not all pre-K is necessarily going to have enduring benefits for children. That you have to focus on the qualities of pre-K and the experiences that both precede and follow it to understand whether children are going to be lasting beneficiaries. First of all, obviously, but really elusively sometimes, we have to focus on the quality of the pre-K experience itself. And researchers have been discovering that quality is not just a matter of curriculum, although that's important. Quality is not just a matter of things like class size, although that's important. A lot of it has to do with the quality of the relationships between teachers and children, the emotional climate of the classroom, the kind of instructional practices that are being used and whether they're developmentally appropriate. So we can really measure differences in quality that really do make a difference. Another factor that's really important is the extent of follow-through there is. What happens if you put a child in a high-quality pre-K program, but they end up going into a public school classroom that's not very high quality at all? Children may end up repeating learning experiences they've already had, and they may not carry forth the benefits that they had learned and that they had gained in a pre-K classroom. Then we also know that in pre-K, parent involvement can be important. Whether parents are supporting the child's learning in the classroom or not can have a lot to do with the gains that the child makes. So it's important for us to recognize that even a high-quality pre-K experience is not a magic bullet. There's got to be things that follow from that are important as well.
It's very interesting that because you said, one of the things that I learned from the session was that it's learning begets learning, that things build on top of each other. And so I was wondering, tell me some of the things that are about even earlier than pre-K, the 0 to 3, what's going on there? Because I know there's more research coming out about the phenomenal stuff that can happen there.
I think that's really true, Phoebe. I think one of the things that has surprised those who have been urging greater preschool availability for children across the country has been the numbers of children at age 3 who arrive at a high-quality preschool classroom who are already behind their peers. And now we have really good research that's showing that experiences in the first 3 years have a lot to do with shaping children's language skills, their vocabulary, sometimes their number concepts. And it also extends to some of what people call the non-cognitive skills, the degree to which children have self-confidence as learners, that they're able to persist in learning challenges, that they're self-regulated and therefore can focus their attention and their thinking and can regulate their emotions and get along with other kids in a classroom. So in a way that we have not had an awareness of before, experiences in the first 3 years lay a foundation for the kind of learning that can occur after children enter preschool. Yeah,
wow, it's an amazing thing. It just reinforces the learning begets learning.
Yes.
And so I'm wondering, obviously I'm a pediatrician and I encourage my parents to read to their children, and there are other things. What are some of the other things that parents could do in that 0 to 3 age and even beyond that would help their children be ready for school and beyond?
I think one of the things that would astonish parents is to realize how much learning is going on in the first year, because it tends to be well disguised by a child's sort of exuberance and emotionality and lack of self-regulation. This child does not look like an Albert Einstein, but their brain is growing in that way. So, telling a parent, for example, that to talk to a child before the child has even said their first word is actually helping the brain rewire itself so it can engage in that vocabulary explosion that begins at about 18 months of age and really take off. So a lot of conversation, a lot of emotionally rich social interaction, a deep attachment to that child, and helping that child develop a warm and secure attachment to you as a parent. And then as a child is getting older and is beginning to use language, to use that language to help unfold the child's experiences, you know, to talk about a walk in the neighborhood or a trip to the supermarket, to ask the child what they saw and to unfold that experience for the child, to use number concepts, counting things that they encounter, to talk about emotions and the child's feelings, other people's feelings, and how you get along with other people. You know, in a sense, part of what parents are doing are being tour guides to this remarkable world in which the child finds themselves, but being tour guides who change in what they offer based on the child's age and the child's developing abilities, to always be at the cutting edge of what children are learning and seeking to discover, and that always, always, always be reassuring the child that the parent has their back, that they're always with them, that they're utterly committed to the child's growth and development, and they have utter confidence in the child's ability to succeed. Those are some really good foundations.
Yes, that's amazing. The other area that we talk about today is about practitioners, both educational providers and healthcare providers. What are some of the things that you would suggest that they do to help every child reach their potential?
Well, with all that we've been learning about the developing brain and mind in the early years of life, it certainly has given us a new appreciation of the importance of the workforce, of professionals who are engaged with children at the very youngest ages and their families. And I think that you know, besides all the things that I talked about that parents can be doing, you know, those in early education, those in healthcare can be developmentally minded in helping to foster the child's healthy development at each stage of life. One of the things they can also be doing is to be in interaction with other professionals who are involved with the same child at that age. You know, to know as a healthcare provider, you know, what is going on in the child's educational experience, to be able to support that, to know what's happening in the family, to help the child in that experience as well. As professionals are working together across sectors, they're able to provide more consistent and seamless support for the child. And in addition, it's important for professionals to be in communication with each other as the child matures, so that there's a seamless growth of the child's learning abilities as they move, for example, from a preschool classroom into a pre-K classroom, into kindergarten, and then into the primary grades. As teachers at each level are communicating with each other, that helps to ensure that the child's learning is building upon prior learning, and that the child is getting ready for the learning opportunities that will follow from that. So communication within sectors across ages, communication across sectors within any age.
Interesting. That gets to the diagram that you had, where there's it reduces the fractionation that you mentioned in the session.
That's exactly right.
Yeah. The other thing about the fractionation is that it leaves gaps. And we talked about how there's early intervention. There's state programs of early intervention. There's also one for educational, if children are expected to have educational difficulties. But what about children who don't meet those? You have to be eligible for those requirements. What if you are kind of falling between the gaps, but you don't meet those interventions? What are some of the things that communities and other adults who want to help children meet their potential, what could they do?
Yes, communities are so important in helping to wrap around the child services and supports that assist the family, who is the primary arena, the primary source of the child's support, but to provide a safety net, as we often say, around that child, but around the family, to help the family and help parents do their job better, and in some respects to reduce some of the burdens that parents may already be facing. So particularly in families that are in economic adversity, communities can provide resources to the family that help reduce some of that economic difficulty. They can provide supplementary kinds of educational sources within the community by which children can benefit who might not otherwise be able to get access to an early Head Start or a Head Start program. Indeed, some of the high-quality pre-K programs that we have been studying for years now were developed specifically to provide support for kids who otherwise do not get it within a federally funded program, but whose family circumstances warrant special attention for them. In many respects, families become the nesting ground within which families can be enabled to do their jobs and in which parents can be assisted in providing all that that child needs.
And I know we have a lot of good resources that are with the session, but could you tell us some of the other ones that if people are interested in learning more, they might look for them?
Well, I think particularly those parents of children in the early years of life who are often seeking information about the mysteries of raising an infant or a toddler would certainly be welcomed and well advised to go to the website of the organization that I'm affiliated with, which is called 0 to 3. And that website is www.0to3.org, and it has a wealth of useful information. The federal government has actually sponsored a couple of blue ribbon reports that have been, one has been released recently, the other is due to be released later this year, that I think would be of interest. The one that has been released last year is entitled Transforming the Workforce for Children Birth to Age 8. And it really talks about the systems of care and education, health, and other kinds of support for children in that critical birth through age 8 spectrum, and talks about how we can engage in a national effort to try to strengthen that system to make it more seamlessly supportive of children as they're getting older. The report that is coming out a little bit later this year is on supporting parents, and it focuses on the essential knowledge and attitudes and practices that parents engage in that help to increase the odds toward healthy, happy child development, and what other kinds of things social systems, both formal and informal, surrounding that family can do to help parents do their job. I think both reports would be of interest and of use to parents and other practitioners.
Yeah, and I know we have a website too for parents that they can check out, the CDC does.
That's exactly right.
Yeah. Thank you so much for joining us. Appreciate your time.
My pleasure.
And thank you so much for joining us. We'll see you next time. Thank you.